Hello, and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. There are now over 186 million cumulative cases of COVID-19 globally. And as at Friday, July the 9th, the death toll was over 4 million. In Nigeria, there were more than 168,000 confirmed cases of COVID-19, more than 164,000 recoveries, and 2,122 deaths. That makes a total of 710 new infections, about double last week, only 54 recoveries and 1 death, recorded in the week between July the 2nd and July the 9th. Recovery rate is down to 97.6%. Case fatality is 1.26%. Tested samples are over 2.3 million and more than 3.9 million vaccines have been administered. And now to the topic of the day. Asthma is an inflammatory disease of the airways to the lungs. It makes breathing difficult and can be debilitating. Asthma affected about 262 million people in 2019, according to the World Health Organization, and resulted in 461,000 deaths. It is the most chronic disease among children. My guest is a consultant pulmonologist, Dr. Olakunle Iroja. You're welcome to the show.
Thank you very much for having me.
Let's start by asking, how do you recognize asthma? What are the symptoms?
Okay, so asthma is one of those conditions that I think everybody would have had some experience with. Either they know a relative or a classmate from school.
Is it that common?
It's very common. It's one of the most common chronic diseases affecting people. Like you mentioned, 262 million people last year, 300 million people worldwide, really, that typically are affected with asthma. And it can last for a very long time, so people will live with it forever. So the numbers keep going up as new cases come in. People might have asthma and might be for a whole lifetime. Though more commonly, it tends to go away as people get older.
Okay.
So it's most commonly known as a disease of childhood, but in actual fact can affect anybody at any age. Even an old person can come down with asthma for the first time in their life, in their old age. But more commonly affects children as they're growing up. Maybe symptoms start getting more and more and more, and then towards their adolescent and their 20s, the symptoms might go down and then go away.
Okay, so basically it's children.
Yeah,
most of the time.
A lot of the time, yes. It starts with children.
And apart from difficulty breathing, what else, characterizes it?
Cough. Surprisingly, a lot of people don't know this. Cough is one of the most common symptoms of asthma. So breathing difficulties, cough, wheezing. Those are typically the symptoms that would alert.
Wheezing is when you can hear the person breathing.
Exactly.
It's like
it
a
has
whine.
A whistling, yes, a whiny whistling sound. So just hear that whistling sound whenever they're trying to breathe or whenever they're having an episode. So it comes in episodes typically.
So how early in childhood can asthma affect, someone?
No. Normally, we don't make a diagnosis of asthma because children can have all sorts of wheezing diseases that are not asthma. So most doctors or pediatricians, they would wait until maybe a child is 5, 6 years of age before they say, oh, this is no longer maybe bronchiolitis, some airway infection. This is asthma, right? So from 6 or 5, you'll start talking about asthma all the way till old age.
Because it's difficult for a child to indicate that. Yes. This is the problem I'm having.
Yes.
I can't breathe well, or it's like my air has stopped and all that. That's why, I'm a bit concerned about the diagnosis in a child.
Yes.
Do you usually have misdiagnosis in children of asthma?
Oh, yes. Lots of people have asthma and then they are not diagnosed. They will go there for ages because the way asthma is, it presents differently in different people. And even in the same individual, they can present in different ways over time. So maybe in childhood, you have wheezing, then in their teens, they might just be coughing, then in their adulthood, they might be having difficulty breathing. So if the health worker is not alert, you might misdiagnose that, oh, this person is always coughing. It's a cough disease, maybe it's tuberculosis, maybe something else. And it's just giving all sorts of treatments that aren't necessarily helpful. So it's important to be aware that asthma can present in
Different ways.
different ways. Yeah.
Is it a form of allergy?
Yes. Now, some people will say
Because
that
it affects some people, it doesn't affect some people. So what's the story behind that?
So there's a way that we try to think of asthma nowadays that maybe don't consider it as one disease.
Okay.
That maybe
A
it's
group
just
of diseases.
that, yes, a group of diseases that look the same. That is, that present with this wheezing, this airway obstruction, this coughing. That the fundamental thing is that air doesn't easily pass in and out of the lungs. So a group of diseases. So some of them, a large proportion of them, are allergic in nature. So you see people that maybe when they're young, this typical thing that everybody would have heard. Oh, I was always having runny nose,
Yes.
itchy eyes, skin issues, and then later on it developed into asthma. It's what we call an allergic match. It's typical history
Okay, so
of
the
asthma.
picture fits.
Yes, that's a typical history. But then some other people, it's never allergy. Maybe it's just exercise. Their asthma is only whenever they exercise. They suddenly can't breathe.
So what does a person do? He shouldn't do any exercise.
Well, with treatment, it can be controlled.
Okay.
So, but I'm just saying that it can present in different ways. Some people, it's only on exposure to certain things. Some other people, it's occupational. They develop it when they're exposed to chemicals at work.
Okay.
So it's different things. They all look alike, but it's different ways that the asthma behaves.
I guess the way to prevent this then would be stay away from the trigger, if possible. How possible is it to stay away from triggers?
Now, trigger avoidance, that's what we say, is one of the major things to do, is major part of the treatment of asthma, because medications are used to control it, but then repeated exposure to triggers is going to give you repeated inflammation in your lungs and makes treatment more difficult. And of course, if you're exposed to a particularly bad trigger, it may even lead to very, very adverse.
Like turpentine, paint.
Yes, for some people.
That can be really bad.
For some people. Some people might be frying red oil.
It is becoming serious. Our own red oil.
Yes, some people it's fumes, some people perfumes. Commonly, of course, dust. That's one that everybody knows. Oh, someone with asthma can't
I
sleep.
hear some people latex.
Yes.
How is somebody going to get asthma from latex?
Yes.
A glove. Yes. How does that happen?
Okay, so now remember, like I said, for some people it's allergic, right? So one thing about asthma is that there's an oversensitivity to certain things in the environment. Now, those things vary from individual to individual. So not everybody, of course, will have latex. But for some people, it's that latex that will just trigger their airways to close up.
Is it that they smell it? Or?
Yes. You know, the little tiny particles everywhere. Your clothes give off tiny particles. Insects, very tiny, minute particles. Once they get into the airways, there are tiny particles floating around. They get into the airways, and then the immune system recognizes it and overacts. And then all of a sudden, the person starts having airway closure, can't breathe, or have cough, or wheezing, or any other symptoms of asthma. So it can be anything, really, anything that can give a particle.
Okay, so here's the question, because I'm still thinking about those children. I know that there's commonly an inhaler that is used. Mm-hmm. You know, asthmatic people use this nice blue and silver inhaler, and you see them pressing something into their mouth. And sometimes it looks like a very urgent situation. And then once they take that 2, 3, 4 puffs, it's like something eases up in them. A child, he's 5, 4, maybe 6, and he has to take an inhaler. It's a serious matter. How do you teach a child to even inhale?
So, luckily in children, they may not have, they will give it, there's enough time. It happens in stages or gradually, and put like that. In some situations, it's like an immediate thing. The airways close up completely. But most of the time, the stages, so there's the breathing difficulty, the repeated cough, and the wheezing, and it keeps steadily getting worse and worse and worse and worse. And then the person has to be rushed to the hospital. So there's that little time for intervention. For young children that can't be taught, a lot of them can be taught. Children nowadays are very smart. You can actually show them how to use an inhaler. But if you can't...
And the exact time to breathe in when they press the inhaler.
Exactly. You've got that right. That is it. thing that a lot of people don't get right, and that's why a lot of people say, "Oh, this drug doesn't work for me," or "This drug doesn't work for me." It's usually because of poor technique. So it's very important that people understand how, and of course, with resources like YouTube and whatnot, people can actually really understand how to use their medication. Otherwise, health workers will teach pharmacists, nurses, doctors. They can teach the proper technique. But in children now, for those children that can't get it, and not just children, by the way, older people too, they typically have difficulties understanding or inhale the technique. So with their devices that can make things easier, they have what we call a spacer device.
Okay.
It's like a little plastic tube. You put your inhaler in one end and you just stick the other end in your nose or your mouth and just be breathing normally. So you don't need much technique.
Oh, I see.
Yes.
Just breathing normally.
Just breathing normally.
And it does the job for you.
Yes, essentially.
Okay.
Just
that would work with a child.
Yeah, it works with children. It's one of the they're not as many as we should have in the country. We don't produce them, but it's available. You just have to look for it.
Isn't it a simple contraption that
it's a very
can
simple,
be made here?
It's a very simple contraption. In fact, I remember some whether it was a news program or something about somebody that or some hospital that locally fabricated something that can be used. Like we're using just plastic bottles.
Okay.
Really just cut a little hole in a plastic bottle, stick the inhaler inside, stick the other end in the child's mouth, and then just...
And there's your spacer.
And that's your spacer. That's all there is to it. So it works. Very useful.
Okay, now, I saw somebody one day getting an injection. And the nurse or doctor, I don't remember because my attention was focused on this person, was giving the injection in, like slow
yes.
portions of injection. Not the way you normally give an injection, you just stick it in, push the plunger down and you're done. And slow. And I was wondering what could be the problem. Said he has asthma. What kind of asthma do you have that somebody has to sit with you and be injecting you in little bits? Why?
So now, I mentioned earlier that asthma, it typically starts off with little symptoms which progressively get worse. Now, when you get to the worst situation, even inhaling medications can become difficult.
Okay.
Now, we don't want that to happen. We want people to present much earlier than that, right? That you don't need IV medications. And we actually, most pulmonologists and doctors, we're moving away from trying to use IV medications because those medications come with side effects. And it's in fact those side effects that makes the doctor to give it so slowly. The drug is almost certainly aminophylline. It's commonly used in Nigeria, not so much advocated everywhere in the world because of the side effects. Right? So, but it does work very rapidly. But again, side effects.
So it's like, you've come to the last point and you have to, serious occasions deserve serious measures kind of thing.
That kind of thing.
And that's why they have to be very careful with it. But what are these side effects?
It usually, it affects the heart. So you can have heart rhythm abnormalities and blood pressure abnormalities. So it's not really advocated nowadays because it's too much stress. And there are other medications. The inhaled medications work, right? It's just you have to use them at the right time and the appropriate doses. Sometimes because of, let's say, inexperience or whatnot, people underdose with asthma medications, whether it's inhaler or the nebulizer. That's the one that's like a little machine.
Yes, when we come back from the break, we have to talk about that nebulizer thing.
Yes.
But on this note, let's go on a very short break. We'll be back with you in a minute. Stay with us. Welcome back. It's Health Matters on Channels Television, and we are discussing asthma with Dr. Olakunle Ileja. You can call with questions on the topic. The number to call is 0808-054-2233. It should be showing on your screen now while we continue the conversation. So you spoke as if how serious or how mild the condition is really depends on the person.
In some ways, yes. It's important to take control of the asthma. A lot of people, they don't achieve the level of control that WHO, every organization is trying to get. the target is for people to live normal lives without restrictions based on their asthma. Lots of people, they don't go to school or miss school days, miss work days, or they don't engage in activities they would love, or they have to change jobs because of their
condition.
asthma.
Let me quickly pause you there and take Okorafo, who is calling from Abia. Hello, Okorafo. What's your question?
Yeah, good afternoon. Good afternoon, doctor.
Good afternoon.
Doctor, I want to find out why is Harmattan weather and dusty weather so dangerous to asthmatic patients? Because you see, people are complaining that during that time they normally have this attack. And do they have special food? And is asthmatic patient, is it hereditary? The so-called asthma, is it hereditary?
Okay, Okorafo.
And the weather.
You've asked 3 questions. That was so smart.
Yes.
He wants to know,
Yes.
Is it hereditary? Why is it more serious in cold and dusty weather? And I think one other thing, but let's go on with that.
Okay, yes. Now, asthma has a very strong hereditary component. Okay. So a lot of people that, if you have a family member that has asthma, the chances go way up that you would have asthma. The closer to hereditary.
So it's a genetic thing.
There's a genetic component. Now, somebody can have asthma and have nobody that has ever been in their family have asthma. But once you have people in your family and you come to a doctor with cough and wheeze, automatically it's almost certainly going to be asthma.
That's what they peg first.
Yes, it's almost certainly going to be asthma. It has a very, very strong genetic component, right? So the genes, they go through families and they can manifest at different times in different ways. Okay, so
then he also wants to know, it seems to be more serious during cold weather and when there's dust. Why?
Yes. Now, those 2 things are part of the triggers for asthma. For a lot of people, cold weather, so whether it's AC, Harmattan, cold climates, they trigger the airways to close up, and so they trigger the symptoms. So completely correct. In a lot of people, it's not everybody, but in a lot of people, cold weather and dusty environment. Dust is an allergen, right? For a lot of people, one of the most common allergens. So people that
is dust.
Yes. So whether it's dusty environment, Harmattan season, you're going by the side of the road and the car passes by and dust pushes into your...
That could happen.
Yes.
Let's quickly take this call from Ahmed. He's in Lagos. Hello, Ahmed.
Hello, good afternoon, ma.
Good afternoon.
Good afternoon, doctor. Please, my question is not concerning the asthma, concerning the, is it prostatus or something for urine?
I didn't quite get that.
We didn't get that. We didn't get that.
Okay. My question is not concerning for asthma. Concerning for, is it prostate
cancer. You can bring your question to us when I have an oncologist on the show. But this is a pulmonologist. He deals with airways. So let's not be unfair to him.
All right. Thank you so much.
Thank you very much. Okay. So you said that there could be heart complications. I want to ask, can someone control his asthma to the point that he can be maybe a sports person, compete in the Olympics, and be asthmatic? Is it possible?
There are Olympians that have asthma. There are sports people that have asthma, quite a number of them. So yes, it's quite possible to control your asthma. It just involves allergen avoidance and using the right medication. So we have different classes of medications. We have the medications that you're aware of, the little inhaler, the blue one. It's called Ventolin.
Inhaler.
Yes, it's called Ventolin or salbutamol. Yes. So it's called salbutamol. And that's what we call a reliever medication. So people take that whenever they have a symptom. It's either they're coughing, wheezing, whatever, or they're having an attack, a full-blown flare-up of the disease. Then they use the salbutamol and it gives them relief. So it's a reliever medication. And we have what we call controller medications. Now these drugs, their main aim is to control the symptoms. So you use it whether you're having symptoms, whether you're completely fine, and it will prevent you from having symptoms. So if you get the right dose for the right individual, it will completely suppress the asthma symptoms.
Are you able to tell if your patient needs, an upping of the dose or a reduction?
Yes.
Based on how he's responding?
Exactly. So that's one of the reasons why people with asthma need to go for regular checkup. So when you see your doctor, he can determine whether your symptoms are under control, under partial control, or not controlled at all. And if it's partially controlled, it might require a slight adjustment of the medication. If it's under no control at all, you might need to
Increase the dose.
increase in dose,
or change
add,
the medication.
change or add. So typically we add medications. We have step like a step 1, step 2, step 3, step 4. You add medications as many as needed to control the symptoms so that people can live a normal life.
Okay,
right?
let me quickly take Taiwo, who's calling from Mowe. Hello, Taiwo.
Good afternoon.
Good afternoon.
Doctor, really appreciate the information we're getting on asthma. It's good. I want to add, mine is most times amazing if anybody using very sharp perfume around me, dust and cold. I sneeze a lot. I've been using the right thing, but the thing is not even helping at all. What if you have for the past 3 days, I used half of 5 milligram of Philippines to go to sleep. And what is many a times because I should not take cold water, which I'm trying to avoid as well. What can I do even in this situation? It's been very worrisome.
Okay, thank you, Taiwo. What I'm getting, I'm not hearing the medications except Piriton.
Okay.
At least I recognize that one. He says that he cannot stand strong smells, perfume, dust. And so he's been advised not to take cold water as well. But that the medication he was given, I didn't get that medication, doesn't seem to be working. So what's he going to do?
Now, in that case, it does sound, because it's a very common thing, when people start saying they react to perfume, strong smells and whatnot, it's usually a little bit of asthma. It's usually asthma. They may not, a lot of people don't want to hear or be called asthmatic or to be told that they have asthma.
Why? It's not like it's
I've come across
something you can catch from someone.
I've come across so many people. I honestly don't know why. It's like a stigma. They don't want to be tagged. In fact, I remember one family, when we were trying to tell them that their child might have asthma, they were very against it. They're like,
Really?
nobody in their family has asthma. There can't be asthma. And it's not, I don't really understand the stigma because it's not a terrible disease. Maybe it's, maybe they've heard so many stories of people dying from asthma or something.
Okay.
So they don't want to even contemplate the possibility. But it's not that
So
bad.
what can Taiwo do?
What Taiwo needs to do is to actually go to the hospital, preferably see a respiratory specialist, confirm that he has asthma. There are tests that we do to confirm asthma. It's called spirometry. Confirm that he has asthma, and then be put on the right drugs and be taught how to use them properly. If he has already been given medication, the likelihood is that he's not using it properly.
Okay.
I see so many people use their drugs, and by the time they use the inhaler, 3/4 of the inhaler comes right back out of their mouth. So it's not getting
So
anywhere.
it's not getting there.
So it's like it's not working, but they're not taking the drug. Do you understand? So they need proper education on how to use their drugs. That would help.
You also spoke as if asthma can actually stop on its own.
Yes.
Somebody had asthma and he no more has asthma.
Yes.
How does that happen? I thought it was a lifelong thing.
It's a very common phenomenon. It happens either the immune system. No, so asthma, a lot of it is immune mediated. That is, the immune system plays the bulk of the problem. There's an overreaction of the immune system.
Okay.
You inhale something, your immune system is so angry at the thing that you've inhaled that it wants to destroy everything and just fight it. So it's overactive. Now, some people, maybe over time, the immune system cools down, becomes more mellow.
Okay.
So
I know this guy. He's been around for a while. Let's just calm down now.
Just leave him alone. And so they no longer react to everything. Those people may still have symptoms later in life. Maybe the immune system has become forgetful. But typically, if it can grow out of asthma. You
Okay.
can. A lot of
That's
people do.
really wonderful news. And it's the first time I'm hearing it.
Oh, you can. Lots of people do. And then if you say, oh, I had asthma as a child, but it can come back. So it's just important to know that if you've had asthma before, it can come back. And pregnant women, again, that's another thing. Some pregnant women, when they have asthma, it can either get worse, get better, or stay the same. So when
In the manner of
during the
pregnancies.
pregnancy, it can get better, 1/3 get better, 1/3 get worse, and then 1/3 no difference.
So it seems to me that with such a condition, you really need to be friends with your doctor.
Yes.
In order to handle it properly.
Yes. Because you can be free of most symptoms. And if you get the right medications, right time, see your doctor regularly, it just means you have to see your doctor a little more regularly than you might want and use medications more than you might want to. But then the payoff is that you live a normal life and you're able to do everything.
That is a big payoff. And with that, we have come to the end of the show. Thank you so much for bringing so much light on the topic of asthma. It's been wonderful having you.
It's been my pleasure. Thank you so much.
And thank you, viewers. It's been wonderful having you too. You asked the most insightful questions. Have a lovely day. I am Mary Alale Yusuf.